going to leave the poll up for a while as we begin our introductions. Feel free to use the chat to get to know one another, share your contact information, where you're calling in from. We want to use these opportunities to network. There's only a couple chances where we can interact with our peers, isn't there? So feel free to use that. And just for the sake of time and to be respectful of our panelists, I'm going to get started as individuals continue to join on. So hello and welcome to today's provider panel. This is the second installation of our Increasing Identification Through Labor Trafficking Outreach series. My name is Charlie Borg. I'm the program officer here at Framework, which is a OVC-funded training and technical assistance program that seeks to combat labor trafficking by increasing identification, improving quality and quantity of services, and enhancing provider partnerships. Feel free to check us out at frameworkta.org. We have there our resource library, which also has our survivor panel, the first component of the Increasing Identification series, and information about us and how we can support you more in your work. In today's provider panel, I'm incredibly excited to be joined by 3 experts in labor trafficking outreach. But before we get to them, we wanted to know a little bit more about you. So I will give just a few more seconds to the poll. Take a look and let us know where you're at in your understanding of labor trafficking outreach. All right, so right now you should have the shared results on your screen, and it looks like the majority of the individuals on the call have a basic understanding. Some are new to the topic and some are feeling confident. We have a couple people on the call who say they know this, they could teach this stuff, but mostly individuals who are learning, which is incredible. Thank you so much for being here. I have to tell you a secret that people who are learning, who are new to the field, are my favorite, because I find it so incredibly encouraging to have more people in this community, more people in this work. And in the anti-trafficking field, there's a need to increase our vantage point to include labor trafficking survivors. And that gap directly speaks to a need for labor trafficking survivors to be seen. Every single person on this call has the power to meet that need. And every single person on this call has the power to help us change the current reality to a new future where all human trafficking survivors, no matter of the exploitation that they experience, have the opportunity to have access to services. So thank every single one of you for being here today, starting or seasoned. And I'm going to hand it over to our panelists so that they can introduce themselves, tell you a little bit about their journey, and give you a little bit of their understanding on how to make that change. But remember, they are the experts. They're there for questions. Use our Q&A feature. Even if we don't get to the questions today, we will email out answers to all of the questions after. And you might be learning in this moment, but that's the first step to becoming an expert, isn't it? So Rachel Parker, I will hand it off to you.
Thank you so much, Charlie. I'm so excited to be here today and just to meet new folks as well who are coming to the table to make an impact on this area too. My name is Rachel Parker. I work with World Relief Triad. I am the Anti-Human Trafficking Program Manager, and we are located in Winston-Salem, North Carolina. I am independent currently right now of World Relief, so some of the experiences still there, but here today, independent of them. But a lot of the experiences that I'll be sharing and reflecting on today have been in that position and continue in that role. Some of which are actually in the facilitation of our Triad Labor Trafficking Task Force, which is the first in North Carolina. And what that is looking like is that it is a multidisciplinary team that is across multiple counties to really enhance our identification and responses to labor trafficking survivors across the board. Thank you.
Hi, good afternoon, everyone. My name is Regina Bernadin, and I'm the Technical Advisor for Anti-Trafficking Programs for the International Rescue Committee. The IRC is a global humanitarian organization located in over 20 cities in the United States and 40 countries around the world. We have dedicated anti-trafficking programs in 13 sites in the United States and Europe. Personally, I am based out of Miami, Florida, and have worked in this field for 15 years. I've and coordinated and participated in targeted outreach campaigns throughout my career. Well, I'm going to be drawing much of my what I shared today from my experiences in working in the South Florida region, as well as with partners throughout the country. I also wanted to share that I have the privilege of being part of the framework team and connecting with many of you all. Thank you, Charlie, for that. And supporting many of you all in your efforts nationwide. Just one more thing I want to add about IRC is that we have been recipients of HHS Look Beneath the Surface campaign funding, as well as Department of Justice OVC funding, and which has allowed us to create many robust and outreach campaigns targeting audiences and industries, including agriculture, healthcare, and others impacted by trafficking, such as domestic labor. So I'm going to be sharing a little bit about what I've done being in the field for so many years, and also what I'm still learning. And that's, I think, part of the important pieces. And we're going to talk about the evolution of outreach that, you know, we ourselves are still learning, and happy to share some of those lessons with you all today.
Good afternoon. My name is Renan Salgado. I'm the director of the Human Trafficking Program at the Worker Justice Center of New York. We have offices in Rochester, Kingston, and Westchester. I've been doing this work for 21 years almost, and have mostly focused on investigations of labor trafficking in agriculture for around 13 years. And the last 7 years, I've expanded those investigations to other at-risk industries. We have been focusing probably for the last 2 years on doing trainings that are industry-specific training and what we call labor movement informed, meaning most of the information comes from the experts on each industry, for the most part, the labor unions, with whom we've been able to strike some agreements for dual training. In the coming year, we're going to launch the Labor Trafficking Institute, which is going to try to attempt to be non-government funded, and is going to focus specifically on industry-specific trainings. Again, labor movement informed. I'm really grateful for Framework to inviting me here, and I'm going to try to share what I've been able to do for the last 21 years. That has been some successful approaches to investigations, to outreach, things that I have been able to apply in training governments. I've trained a few Central American governments, Interpol, the UFW, Farm Worker Union, and yeah, I'm just happy to be here, and thank you, Framework, for having me here.
Thank you all so much. Rachel, Regina, Renan, oh my goodness. I cannot wait to hear from each of you. So let's get started. Audience members, don't forget Q&A feature at the bottom. Feel free to upvote things you really want to hear about on the call. So Rachel, can we start out with you? And when did your labor trafficking outreach journey begin? Was it always a part of your work and your role, or did you kind of move into it?
In providing the services that we were providing for aftercare, we had a pretty good percentage of labor trafficking survivors from the beginning, and in sometimes the higher percentage of survivors that we were serving across the board, because we do work with both sex and labor trafficking survivors. But in reflection upon this, as we were collaborating with partners, we were realizing that the identification wasn't happening here in North Carolina. A lot of our clients were relocating to North Carolina because of resources or family reunification, all of these different processes as well. But so it identified that it was present in the nation. We know that North Carolina has a thriving economy, has all kinds of diverse aspects as well, with agriculture and different labor industries. And so it really just kind of befuddled us of why. And then I had to take a step back actually, and I looked at our collaborative partners, and a lot of the folks we were working with, which are fantastic partnerships, were really geared around sex trafficking focuses, domestic violence and sexual assault shelters, law enforcement, connecting with vice and narcotics units, sexual assault and child sexual assault detectives. So in that, we really identified that we had to diversify our collaborative partners as well. Not only in just the integrity of the services that we offer, because we, trying to help our clients rebuild and integrate into the community. So we have to have community partners there, but in just having those who are going to be able to identify and spot what we see. One of the things that I do identify, or I feel, and I share with our community, is that sex trafficking, while human trafficking is hidden, sex trafficking, the person's body, is the product. And in labor trafficking, you don't have those indicators a lot of times. And so we really have to reach out, connect with our community, identify the red flags, the complaints around different aspects of labor, that we can investigate to see if we have the appropriate labor protections and the appropriate access to resources, and that we are just moving forward with that identification.
Thank you so much. Other panelists, what about you? How did your journey with labor trafficking outreach kind of begin and evolve?
Well, for me, it was I was hired by it was called Farm Worker Legal Services in 1999, 2000, like right at the transition of into the new millennium. And Farm Worker Legal Services had always been doing cases of what we were calling slavery back then, or pseudo slavery in agriculture. Farm Worker Legal Service. So we had a very solid understanding that the history of agriculture and the history of slavery go hand in hand globally. So we were doing these cases since 1981. Then, they morphed into different ways, like wage theft cases, indentured servitude cases, debt bondage cases. But it was the same thing. It just got rebranded in 2000 to labor trafficking, human trafficking. So it just fell in naturally. Once the TVPA was passed, then we were just doing what we kept doing, which was investigations of this kind of crime.
Thank you so much. It sounds like, even with your introduction and your 21 years of experience, that this has always very much been your pathway. Regina, what about you?
Sure. So my journey began in 2005 when I began working in the anti-trafficking field as a case manager. So this was in the early days, like Renan, of anti-trafficking, the anti-trafficking movement, where we were just starting to understand even the correlation between outreach and identification. So in other words, of course, that the more visibility, the more likelihood that you will receive those tips and calls to refer cases, which of course now seems like a given, but at that time it was kind of news to us. So for example, in that first year when we began serving survivors, we had 2 cases. But of course, as we increased our direct outreach efforts, we started to see a significant rise in those that we would serve, which I think still now when people are asking us, is it that we are seeing more victims? Are we seeing more victims because there's more trafficking, or are we seeing more victims because there's more outreach, right? We're always still stuck in finding what is the appropriate response to that. But at the time we were focused on direct services, and we received permission from the donor to utilize funds to launch a grassroots campaign called Let the Truth Come Out. And it was focused on raising awareness in the agricultural fields in South Florida. And I think one of the things there is that we saw the role of case management, and in which it didn't just focus on the direct service provision, but also on that outreach and that public awareness. And I know that Rachel talked about the multidisciplinary approach to our work, where we're drawing in, it's not only it shift what case management, or what does a caseworker look like in the anti-trafficking field compared to working for a resettlement agency, where the job description is very structured and very defined. With trafficking, it encompassed a little bit more. And also it helped us to draw non-traditional partners, like those that maybe weren't serving labor trafficking survivors at the time or didn't know what labor trafficking is, but those industries we knew were being impacted. It helped us connect with them and draw them also in our efforts to combat the issue in our region. So, and that's of course now, so many years later, it looks a little bit different. Things that were are now standardized at the time were just innovative and were brand new. So that's how I got started.
Oh my goodness. I mean, I knew that your history and your work was impressive, but I'm so excited just in hearing that you, I think like a lot of people potentially on our call, especially providers that have only ever worked with sex trafficking survivors, weren't really seeing the clients. You knew that the clients were there. You saw 2 of them, and you went out in this really innovative way and made all these things happen. So it sounds like you have really been at the forefront of learning and leaning into outreach and its correlation with identification from the beginning. So thank you so much for all that you do and all that you have done. So I'm also curious, panelist members, how do you choose who you are reaching out to? What kinds of techniques do you utilize when you're making those decisions?
To start off, I mean, you have to see what your organization is structured to handle, what is the capacity and the knowledge of the organization. So like I said, our organization was Farm Worker Legal Services, so we were structured to target agricultural workers. Our capacity in terms of language, you know, mostly Latin American population that was migrating, so Spanish speaking, knowledge of the organization, of the industry was key at the same time. And also, one of the things that you need to know is what's your access in terms of like who you're going to target. Do you have access from that community to that community? Do you have trust from that community? Because we were farm worker legal services, we were providing legal services to the farm worker community, which meant evictions, workers' comp cases, so many different aspects of the law that we gained their trust. So when it came to investigations or outreach for purposes of labor trafficking, then it was a good fit. In terms of how to reach out, or what do you need to reach out to you know, to do successful outreach in labor trafficking, I think one of the things that you need to do is know what's the available data that's out there for you in order to identify, like, so that if the question is who do you know who to reach out to, for us it was definitely with the industry knowledge of agriculture, it would be that, but also when we expanded to other industries like construction, hotel, restaurants, then it was more like, how do you reach out? You know, so we were using a lot of available data that was, for example, from the Department of Labor on farm labor contractors, which were the licensed farm labor contractors, and which were the unlicensed farm labor contractors. Then we would see in the data which farm labor contractors had lost their licenses because of violations. So that would guide our targeting into which farms we would do outreach to. We would try to do outreach to the farms that had unlicensed farm labor contractors with a history of violations of certain laws, right? So that's one way to do it. Also, if you have, if you're lucky enough to have access to labor unions, to have good connections with the labor unions also have a lot of database on other industries and on their contractors. For example, labor unions have a huge database on which construction contractors are out there that are non-union contractors that also have had violations in other states. So when someone comes to do construction in your state, you can have a lot of information from the labor unions as to what's the history of that construction company or those contractors. So same thing with, if you're dealing with guest worker programs like H1B, H2B, H2A, there's a lot of ways that you can target who do you do outreach to, and same thing, see where there's violations in the past, see where there's discrepancy in the job orders. If you take the time to look at all the job orders, for example, in agriculture of the H2A orders, and see that there's discrepancy because the the grower is asking for 40 workers, but the capacity for housing is 35, then you start thinking, where are the other 5 going to sleep? So little things like that that are flags. Having a good relationship with health inspectors too can guide who do you do outreach to. Health inspectors can give you a good idea of, once again, where are the violations, in which industries, and in which particular employer. Blogs can guide who do you do outreach to, how do you target that. You could go on Yelp, you could go on different websites that rate certain businesses and see what the comments are from people that have gone to those businesses. It could be a restaurant, and in the ratings it says, well, this restaurant had this thing and that thing, which could be a flag for serious violations besides health inspection or besides the treatment that they receive. But it could also be they witness minors working there, they witness the treatment of the cook, things like that. So social media is another one. But that's pretty much how at Worker Justice Center we have targeted who do we do outreach to, and not just blanketed but specific target of what we feel are the highest percentage of possibility of violations, which include labor trafficking.
So it sounds like at your organization, you had a direct population that you knew you wanted to reach out to, and that you weren't quite sure how to be most efficient and effective. So you utilized data sources from the Department of Labor. There are some great resources that Framework will be sure to share after that do share information on visa hotspots and different types of visas, so agriculture, construction, domestic work, etc. So we'll be sure to share that information out, and that you also were kind of creative in this new digital age and utilized social media and review sites, which I think is something that we can all kind of relate to too, because I think that even if you've never quite thought about labor trafficking, you've probably been to a restaurant, got a Groupon, not calling out Groupon, but where you get a massage or something like that, and you go to the place and you're like, I'm not even sure that this business was set up to actually be a business. Might be some indicators, might be something to be curious about. Thank you, Renan, so much. Other panelists, how else do you choose who you're reaching out to and how you're doing it?
So our journey is a little bit different because we are newer to the outreach, the intentional outreach around labor trafficking. Similar, so like following along with the journey, we actually were able to apply for some funding and hire a staff person that was able to lead us in the formation of a task force and the creation of that actually. And so reaching out to various stakeholders as we were looking at where to start first, because we wanted to identify what are some of the vulnerabilities and equip our community to identify and to respond effectively and efficiently as well. And so we were trying to come to the table for that in the ways similar to what Renan was saying, is comparing and contrasting data from the Department of Labor according to like what type of industries did we have that were the primary ones in our multidisciplinary, multi-county area, and then where the citations, where the complaints that are happening, if there were deaths, what was that, where were those at, so that we could highlight, we could prioritize which industry to look into first. But it was interesting actually, because we had a little bit of a departure from that too, in that when we were working with our initial stakeholders, we had some folks at the table that were homeless service providers, and they raised their hands and said, we see a consistent need to vulnerabilities that we have to address, and we have this right now, it's pressing and we need to attend to it. And so actually it was interesting because we ended up taking a step back from looking at specific industries, and instead we looked at a vulnerability group, and within that the folks that are unhoused in our community, we were able to create a survey with input from various experts as well, and then we conducted that with task force assistants at various homeless provider shelters, learning different things from, have some mints to having little Uber gift cards that we'd raffle off. And of course, when is the best time to go? Because if you're going during lunch, you would think that most people would be there, but sometimes, just the flex and flow of when people are at the shelter, there wasn't like any specific time that was the best time. And we had that survey, and in it we were able to, we had 95 participants, and about 40% had 3 or more red flags of trafficking that they identified, and 33% for more red flags of trafficking. And they were a whole host of general red flags that we were doing. And in fact, we identified while we were there conducting the survey, an employer walked in and said, hey, I need so many people, and this is what it is. And, people got up and they left, and they went to be hopefully to get a day's wage from them. But in those, the vulnerabilities and the particular areas that we saw were sales crews. We saw with fairs coming in. We saw construction. There were some concerns for illicit commercial sex as well, where women that were scantily clad would walk in and seek to recruit as well. And so those are the areas that we had focused on. Our current focus is on begging and sales crews, actually. And that was led a lot as well because we found a significant need by clientele that was being referred to us, and really needed to address what those look like. And so that's how, kind of a roundabout way of multiple different factors that really just kind of pushed us down one particular avenue.
Thank you. Thank you all so much for sharing your insight. And I wanted to bring up a common reality that I think providers across the field have different images of the people that experience labor trafficking and sex trafficking. In the sex trafficking field, we've moved from viewing survivors as underage white girls from middle-income backgrounds to the reality that anyone, young, old, American, foreign-born, cis or transgender, male, females across all ethnic backgrounds and socioeconomic statuses can be survivors of sex trafficking. Where do you think that the field is in the idea of who labor trafficking survivors are? And how do you feel this impacts outreach campaigns?
I think I'll take a stab at that real quick as well. There are definitely images out there of who we expect to be the victim and who pulls our heartstrings the most as well. And we have to be very conscientious of that we move ourselves and our community and our partners away from that, because the victim we're looking for is going to be the victim that we identify. We actually got caught in a little bit of a situation like that ourselves. We have a current youth outreach program that we're working with a local youth shelter on, and the intent was really to prevent potential sex trafficking. But of course, there's a whole host of vulnerability factors that can be exploited, and in the curriculum that we've developed, it covers labor as well as sex. It's across the board, so it doesn't discriminate on that either. But we instead encountered a youth who, her mother and her were homeless, and a Good Samaritan couple had offered them a house, an opportunity to just come and stay at their house. And then they pulled the youth aside and then said, by the way, we have a restaurant, and you now have to work at this restaurant to pay off this exorbitant rent rate that wasn't stated beforehand. And they're really exploiting the vulnerability of the youth there that has no knowledge of this. And it's like, do I go to my mom? Do I share this? Like, how do I make this work? Because this is now our shelter, our safe place. And it called into question these vulnerabilities. And again, we didn't expect to find that situation, but we have to be aware that human trafficking is nefarious, and it comes in so many different forms, and we have to be open to what that looks like, so that we can engage that as well. And then also really having to diversify your partners, because again, as we were finding, a lot of our partners initially were around sexual violence, and that's who we were identifying locally. And so the more we diversify our partners, the more we see people of all ages, genders, ethnicities, all backgrounds. And so being able to do that, and if you're not aware of the diversity of the victimization, then how can you reach out to them also? So especially, getting people to pull into that, to the table, to come to the table, who are passionate about that, because I think that's also a question of like, how do we get partners to the table? And I think we're going to talk about that later. Some of the, and just to kind of, again, push the boundaries here, is that we've seen labor trafficking within begging and sales crews. Within the begging crews, there have been organizations that have identified themselves as ministries, and they reach out to those who are homeless or who are unhoused, who also may have addiction issues as well, who don't want to go to a homeless service provider. They've been that route and it hasn't helped, and so they're looking for something different. And then they'll get them into the house, and they have a fundraising quota. And what does this look like? And I could go down the street, because that's our focus. So we're focusing on that right now. But we've had clients from a whole host of things: hair braiding salons, nail salons, domestic servitude, drug trafficking as well. And I really want to push our knowledge of what this may look like, especially as the push and pull factors to have a youth join a gang. They may not have really any choice, especially if there's gangs rife in their school, what those peer pressures look like, and what does that look like too, of requiring a youth or an adult to carry drugs and carry across state lines. And if they say no, what does that look like? We have seen and served youth from other nations, from other countries, where this has been identified as trafficking, but we haven't really identified it for US citizens yet here. And so we have to look at that as that they are very strong vulnerability factors right there. Hostess situations, also in the home. We had, coming off if I'm taking too much time, but where someone, especially I think in COVID days, this could be a really high vulnerability factor, but inviting people to the home, and you're selling beer and you're selling all these, food and snacks and stuff, and, pressing children or other people into making nice with people, getting them, you want them to buy from the house, because again, you're making a profit. This is now your living. You've created an in-home club or bar atmosphere, and you're using the people in your family or your friends or vulnerable people to increase that buying. And then it's a slippery slope of just continually increasing and moving forward with that. And of course, you have to identify illegal massage industries and businesses as well. A lot of times we think of this as strictly sex trafficking, but really there's a whole host of labor trafficking violations in there as well. And that also, I think, is a trend to move away from the prosecution according to sex trafficking, because if we're looking at illegal massage businesses, that person may not be able to be a good witness for you as well. And so if you can move it towards a labor trafficking investigation, it's now reliant more on paperwork, the trail of the finances, all of these different things, and it takes away from that feeling of shame potentially out there of having been involved in commercial sex.
Thank you so much. It sounds like there are a variety of ways that these preconceived notions that we have on who a survivor is actually impacts and does a disservice to our outreach and who we're looking out to in a variety of ways, negatively impacting individuals experiencing sex and labor trafficking, because there's a great amount of crossover, and because there are individuals being exploited across a lot of groups and across a lot of industries. One of my the statistics I find most interesting is that in a Covenant House study, 81% of the youth that were identified as experienced labor trafficking actually experienced exploitation for illicit activities like drug sales. So thank you for touching on those illicit activities as well. So I am curious too, how has outreach for you all evolved? Who are your MVPs, and what are the most important lessons that you've learned?
I'll start that one off. And so I think in the beginning it was, and mind you, like I said, I'm going back 15 years. And so I think in the beginning, outreach it was very simple. It was focused on just getting the information out there. And since then there's been an evolution, and where then we shifted to working in collaboration, right? With other partners is what we now kind of know as the multidisciplinary approach. And it was multidisciplinary, a lot of times we use that more from the service provision side, but also with outreach, in which you go hand in hand with law enforcement out to a field or to a different, engage in different activities. And you show that collaborative nature of how you work together to be able to help and serve these vulnerable populations. I think also from a safety perspective, right? We saw the benefits of those partnerships, particularly when we were going into communities where trafficking, of course, could be taking place, which was the reason why we picked these specific industries or specific communities to go into. And I think us as service providers also learned about the fact of, in our passion and dedication and wanting to reach out to survivors, the fact that we could also be placing them in harm's way because they were being monitored by traffickers, and because of, right, as we know, people could be freely walking around in our communities, but that does not mean that they're not in a situation where they may experience violence upon returning, right, to their home, and potentially we could be putting them in harm's way. All of those things that are now common practices and things we know at that, and now are institutionalized, we were able to do so now through trial and error. So we had to learn. So as we talk about that evolution, in the last few years, of course, we've seen the incorporation of survivor voices, which have helped us to shape not only language and imagery of the tools that we develop, but I think also the methods to connect with survivors. It's no longer just printed material, but social media and using apps for advertisement. So for example, in the Super Bowl in South Florida this past year, we were able to partner with ride sharing services that were able to include information on trafficking when being used by the by the passengers, excuse me. And so those important lessons, that evolution, what it showed me, and the most important lesson is that we can't remain stagnant. And as I said, we are still learning ourselves. So even though we've been doing this work for years, and I know a lot of you are just starting, but what I encourage all of you, no matter if you're in year 1, 5, or 10, is that you take the time to reevaluate your tools, your methods, your approach periodically. For them to remain effective, you need to do so. And now, for example, living during COVID is a perfect example of how we're needing to look at different ways of delivering information. And that's considering both safety, right? Before we think of physical safety, here's a different, what safety looks like in the context of COVID. And also its effectiveness and approach, how we're delivering information during COVID. It's a little bit different of how we've always done things or how we've traditionally done things. So that's what, at least the evolution that I've seen in these 15 years of working in this field.
Thank you so much. There's a lot of great information there, information on being considerate about the safety of your clients, being considerate about the methods that you're using, and curious about when they're working, how they're being efficient, and what other areas you can go into, whether or not it's social media, whether or not it is going out into the community and conducting outreach, partnering with organizations, with the people who are going into the businesses and informing and educating, like at Renán's organization, and all of the other opportunities that are available to you in creating and conducting your outreach.
May I?
Yes, please.
May I just add faith-based groups also? And I know that was part of what Regina was talking about as well, but we're now at a point where, all of our collaborative partners, they're focused on multiple things. And so really engaging the faith-based to have the word of mouth and assist as we're crafting additional messaging, but they, and community organizations, having them kind of push that information out is really important. So they're a great tool.
Thank you so much. And so we just have one last question before we move to the general Q&A. So throw them in that bottom feature. What do you feel are the top 3 things providers should consider when creating successful outreach campaigns?
I'll take this one. I think you need to have a safety plan before you start anything. And a safety plan can mean so many things. A safety plan for yourself, for your coworkers, for your organization, safety plan for the potential survivors that you may encounter. You also need to already have an established referral network. I mean, if you're going to get into this work, you cannot just get into it without having um, a good network of who do you reach out to that are the experts or the ones that are better positioned to help deliver services to survivors. And the third one I would say is you need to have a really good understanding of what client, or in our, we call them clients because it's legal services, but victim-centered approach to everything. Victim-centered approach to outreach, to intake process, to referral process, to follow-up process, you know, victim-centered, trauma-centered approach to everything you do, and keeping, and what does that mean to you and your organization to keep it client or victim-centered approach, which to us it means who's defining justice. You know, what you may project as your view of justice or law enforcement may project as their view of justice may not be what the client's view of justice is. So I think that's super important in everything that we do.
Thank you so much. And thank you all for continuing to bring in the survivor piece. Another great way to evaluate whether or not your outreach is working, asking people that you're connecting with, where did you connect with us? Where did you see this? Actually gaining information about where your strategies are being most effective, whether or not it's in person, you're leaving flyers, what have you. We're going to move on to our Q&A feature. So I'm going to hand it over to my colleague and the Deputy Director of Framework to finish that portion. And before we get there, I have a question, and I'm the moderator, so I'm budding. I apologize. Renan, at one point you talked about how you were predominantly a Spanish-speaking organization, and that you were kind of thinking about these other areas and other languages that you may or may not have had resources for at that time. I think that's a pretty common thing. How did you navigate that? And would you recommend that if you only speak English, just stick with English, or what do you think?
No, I mean, there's different approaches to it. And it also depends on what your organization or yourself's mission, vision, what are you trying to do? Like, are you trying to do case by case patchwork? Are you trying to do systemic change? Are you trying to do preventive work? Which is something also that, back to the previous question of like, how has outreach changed? I think for many organizations, the more you're into it changes into preventive work, not only case by case, right? So to answer your question in terms of like language access or diversifying your hiring process, right? It depends on what your mission is. I mean, if your organization is specific to Chinese restaurant workers, for example, then that's your hub, right? But if you are really trying to do systemic changes in labor trafficking, then my advice is that you diversify your approach, not only in language but also in your purview. To give you an example, this year we hired someone that is specifically knowledge of the platform economy, because we're trying to see the future of labor trafficking as the platform economy, right? They have a lot of parallels with the history of agriculture, where you have huge, super powerful corporations that are framing policy to defend themselves against any possibility of prosecution. So we're seeing that with Amazon, we're seeing that with anything that's involved Uber in the platform economy. So to answer your question once again, like, you need to like sort of see what is it that you want to do with this particular thing, if it's systemic, if it's futuristic work, and try to have capacity for it according to what you want to do.
Thanks.
So we have a lot of good questions in the Q&A. Thank you everybody for submitting those, and keep them coming. The most popular so far, no surprise, is a question about the current pandemic and how the heck you do outreach in this context. I'm going to throw it to you, Rachel, first, but as you're thinking about it, just want to share a couple of the takeaways from an event we had earlier this year, closer to the start of the pandemic, where folks shared creative ideas for partnerships that would really leverage some of those access points where, since people aren't necessarily going to work sites anymore that used to, including outreach workers, inspectors, and things like that, to really look at where victims and survivors are going. What are those essential services that are still operating? So things like grocery stores and local markets, healthcare facilities, laundromats, money transfer centers, utilizing social media and online platforms to reach people, post offices, religious centers. So those are some, consider again where folks are already still going to put up your messaging and make sure that they have an opportunity to get in touch with you. So I'll pass to you, Rachel. What are your thoughts about how you can connect with people during the pandemic?
It is definitely a complex and new day, new time. So, as Renan was saying, there's different types of outreach also of, are you needing to do outreach and education with your collaborative partners as well? Because as we are working through our Triad labor trafficking task force, we are identifying from those members that their agencies are not prepared to identify. They're not going to be at that level. And so that's also another thing, because if we are really trying to get that information out there, and someone comes to represent or seeks services out to an agency and they're not recognized, then you shut the door also. And so it's a very vulnerable time period to try to engage someone. So we want to do that. Also, we are blessed with our state human trafficking commission, actually, and they just did some geo-fenced ads. And that means that they did them in specific locations, either somewhere according to addresses, but for the majority of them, we asked them to just blanket the whole community. So anytime someone went online during that time, they got some ads about what labor trafficking looked like, what trafficking of minors looked like, what all of these different diverse pieces that we see of that make up human trafficking are happening. And so also, there's been some great feedback, I think, that I've heard about radio ads, things that don't cost a lot of money to be able to pull together, and then also being able to collaborate with local universities and schools of arts and things like that to just pull those ads together, and being able to plug that in. And then there was one other thing that I wanted to mention, but I think I have forgotten it, so I'll have to chip in later as well. But those are kind of some of the starting points to identify.
Sure.
And can I go ahead and add something? One of the things that I think, and the last question that Charlie asked was about the top things that providers should consider. And I think even in COVID, two of the ones that I was going to share is to know your purpose and know your audience. And I think we still during COVID times need to know that. And so, for example, when Rachel mentioned radio, I know with the Haitian community here in South Florida, one of the best ways to get information out there is through radio, and that's the community themselves have expressed that to us, that that's the best medium of communication. And so I think that as we continue to do our outreach and we look at what message do we want to, we have to consider, why are we doing this? What are we trying to accomplish? And then understanding who that community is. And so as you talked about all these different industries, looking at, for example, if we're looking at agriculture and still, I'm thinking here of our community here in South Florida, they are going to food distribution sites. They're still accessing certain community health clinics. They're still going to money wiring stores to support families abroad. And so, of course, looking at safety of staff, but is very important. So how we get that information to those locations. But I think part of it is that a lot of these partners, a lot of these agencies were partners from before. A lot of them are nonprofit, a lot of them are government. And so we can maybe piggyback on a lot of their efforts. It's a matter of now getting the information out there and maybe doing a little bit more of like a train the trainers type of engagement, in which maybe we ourselves are not going to be the ones out there providing directly the information, but through partnership, being able to pass it on to those who maybe are right now being called to be those first responders or are on site, being able to provide that information, that we can still get it out there. Maybe just our approach needs to be shifted a little bit.
Perfect. We have another question here that...
I'm sorry, I remembered the one that I wanted to add to.
Yeah, go ahead.
So similar to what both you and Regina were saying, people are still needing basic services and grocery stores and money transfer, things like that. But in particular with like begging and sales crews, if you have a permit that's required, if you can draft a brochure, a poster, and make sure that wherever they go to apply for that permit, that is posted, that the information is where construction or licensures are being gained as well. And so I think really targeting some of those areas, and that's the final piece I wanted to say. Thank you.
That's perfect. And it's a good segue too, because as you're talking, it strikes me the amount of work and time and energy and other resources that go into doing outreach. And not every organization that does anti-trafficking work or is looking to increase the identification of labor trafficking survivors is currently funded to do direct outreach. And so I'm wondering if you can speak to, I'll throw this to Renan first, what recommendations you have for balancing that reality of needing to reach people in your community, but not maybe not having the funding for it right now?
That's a personal one. I mean, it depends on what your capacity is and what your time you have. I mean, when I started doing this, I always used to tell the director way back when, this kind of work should not be paid. This kind of work should be, we all should have second jobs and do this work on the side. Because once payment starts getting involved, once government start getting involved with the funding and the guiding of where the outreach goes and what are you supposed to be doing, blah, 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 then it starts getting a little shady, in my opinion. So if you have the interest and if you don't have the funding and if you do want to do the outreach, I mean, you just got to see who you connect with that does have the funding. I put it in the chat, the labor unions, and I will always push this, and Megan, you and I go way, way back. So, I've always been pushing this. Labor unions are the experts on labor, period. The fact that they're not invited into this fight, that I don't see them being invited into any kind of conferences, economists are not being invited. It's the same people being invited for the last 20 years since the passage of the TVPA, except the labor unions. Reach out to the labor unions. Labor unions have the funding. Labor unions have the daily outreach 7 days a week, the knowledge of each industry, the access to the workers. Just reach out to them. And, we're living in the age of social media, the age of WhatsApp. There's so many ways to do it. If you really want to do it, you could do it. It doesn't have to be guided by funding. You can also diversify how you do get what you do get funding for, and then try to get creative in how to loophole it so that you still do this work even though you're funded for something else, depending on what your organization is. I mean, I'm lucky to be in a legal services organization, so even though we get funded to do legal services for, let's say, workers' compensation or immigration relief, there's still a way to put human trafficking in there. So you could get creative, and again, don't let funding stop you from doing something that we all should be a part of.
I feel like you're going to get some emails from folks looking for advice on how to get creative
I hope so.
to allocate some funding there. My big takeaway from that is an important message of, we don't have to do this alone. Each organization doesn't have to do everything. We're not going to solve this problem by ourselves. And so look outward, understand who else is doing this, and partner up. So we have time, I think, for one more, maybe two questions. But this is a good one as well, in terms of what are the biggest barriers to getting people out of a labor trafficking situation, and maybe connecting that also to the follow-up, which is service provision. What have you all experienced in terms of barriers to engagement? I'll throw that to Regina first.
Sure. I think that, and actually going to, I know Charlie was talking about, and we've weaved it in throughout the presentation about partners. I think that particularly if we don't belong to or we're not representative of that community, a lot of times, the rapport building is really challenging. And so you have someone, and statistics and data have shown that most of the time the trafficker and the survivor are from that same community. And so if you have someone that trusted a member of their community and they ended up in a situation now of being exploited, why should now they trust us? Also, a lot of the messaging that they might have heard during the trafficking situation is around the fact of do not trust, right? Whether it's law enforcement or do not trust, others. And a lot of times they don't understand when especially because we talk about this multidisciplinary piece about about working with so many agencies. They don't understand our particular role, in my case, as a service provider, and what it is that we do, and how that's different from all the other partners, including law enforcement and so forth. So I think that going back to your original, question, the biggest barriers I think are rapport building, but that's where partnership comes in. And I think that it is a combination of also connecting with people from that same community that can serve as community mediators, and can, whether it's vouch for us or help us to understand, as a lot of times our work is very reactive, so we react to something that's happening, but I think it's also, we need to do the homework and we need to understand the community, the dynamics, the culture, and culture can look like in a lot of different ways. It's not just language and background, but just understanding the dynamics there and seeking the right partnerships in order to be able to support. And then of course we have all the other pieces of how do we get our tools and everything to be appropriate, and that goes into service provision, right? I talked about adapting to that outreach needs to evolve, and so I think service provision needs to evolve as well, and the tools that we use as well. But I think the biggest challenge I can say, as having been involved in service provision for 13 years, is rapport building, but there are ways to do that. We can't change who we are in the sense of like maybe how I look like, but I can go ahead and inform myself and become more educated in order to be able to come to someone and say, and it's fine to say, I don't know, please teach me. Let's work together, because at the end of the day, it's a partnership, right? We are working alongside the survivor in order to move forward, with the goal of moving forward, with the goal of helping them gain stability, and it's, we're doing it together.
Thanks so much. So just to wrap up, I know Renan had a chance to give us his big 3 takeaways. Regina and Rachel, what are your final thoughts to leave with our attendees today? I'll throw it to Rachel first.
I have to get my thoughts on that one, but lean in. I think the message that Renan, that Regina, Megan, Charlie, all of us have been saying is there are partners out there. Lean in. Identifying, what is your community seeing? What are the most pressing needs? And also, with lack of funding out there, what are the funders wanting as well? Don't chase funding. Be able to know what your capacity is and what your focus and goal is. But then there are plenty of interested funders. And keep in mind that for outreach, that's about identification and prevention. So those are your 2 key words right there. And so who in your community is about enhancing the protections for people around that, and just making sure that you have the voices at the table that are diverse, that are representative of the people that you're wanting to provide those services to, and inviting them in that, so that the dignity of that person is upheld as well. That is a big piece.
And for me, I'm very encouraged by having seen the attendance of today's, event. And as I talked about several times in the last hour about the fact of, the evolution, and we talk about partnership a lot of times when it comes to service provision, but outreach also requires partnership. And so I think that I encourage folks to keep learning, keep engaging. I think it's wonderful to see the interest that there's here, but we got to keep the conversation going. And so, this is going to be my framework plug of just continue to be a part of these conversations. Please keep submitting your questions. Please keep engaging through the different platforms that are presenting, because, trafficking, what it looked like 15 years ago, some things are still the same, but some things are different. And like I said, I'm open to always learning from all of you and hearing of what's happening. And then I hope that you remain open to learning as well. It's going to take all of us together to continue to combat this issue and be able to be, as effective as we can be.
Thanks, Regina. The Q&A portion is now over. I will toss it back to Charlie to take us home.
All right. Thank you all, every single person on this call, for being a part of today. Thank you to every single one of the panelists, Rachel, Regina, Renan. You were incredible. You shared so much insight, and there will be a recording of this sent out to everyone if you want to grab pieces again. I also posted a link for the survivor panel if you want to learn more about what survivors say about who and how to reach out to them with different language backgrounds, individuals who were children or adults at the time of being trafficked. It's a really interesting event. Give it a listen, it's worth the time. And otherwise, if you're interested in staying up to date with our future events, I've added a link for our newsletter. Please stay connected with us. We want to be connected to you. Give us your feedback in the survey. There is also a link for that in the chat. Let us know what you thought of today. And otherwise, reach out to us if you're interested in collaborating with us as subject matter experts, if you're looking to build something in your community and want a second pair of eyes, or if you want some individual assistance on a case or on a program that you're developing, Framework is here for you. Thank you so much. And in addition, if you do sign up for our newsletter, we are hoping to do something for National Human Trafficking Awareness Month in January, and we're gonna need some helpers. So sign up for our newsletter. In the next couple months, you'll be able to learn about what we're doing and learn and ask us questions about how you can do something too. Thank you so much.